1,000 to 3,000 children undergo SBS, shaken baby syndrome, each year. 1 out of 4 victims die, and 80% survive and suffer from the endless damage. Those are the statistics shared by the New York State Department of Health under the title Shaken Baby Syndrome Facts and Figures. I used research and my own personal knowledge on why shaking a baby is dangerous and should be avoided. According to the American Society for the Positive Care of Children and the article Shaken Baby Syndrome is Preventable, SBS can be stopped. It is a severe form of physical child abuse resulting from violent shaking of an infant by the shoulders, arms, or legs. SBS may result from both shaking alone or from the impact of shaking. Babies, newborns to 1-year-olds, especially babies 2 to 4 months, are at the greatest risk of injury from shaking. This is a clear indication on how dangerous it is to shake a baby and why it should be avoided at all costs. My audience needs to be informed about the dangers of shaking a baby. You should never shake a baby for several reasons. Firstly, shaking a baby is considered to be child abuse. Secondly, shaking a baby can cause serious brain damage. And lastly, shaking a baby can result in death. Now let's go into further detail. Shaking a baby is considered to be a child abuse. Child abuse is real, and it comes in many forms, whether mental or physical. In most cases, could injure both. One example of child abuse is shaking a baby. Baby shaking is an obvious form of child abuse. Many infants and toddlers suffer from it daily and are being significantly affected. As a full-grown human, we all should comprehend the fact that babies are extremely fragile beings and that we should take caution. In the article, Shaken Baby Syndrome, a biomechanics analysis of injury mechanisms, the author Faris A. Nandek discovered that a nurse caretaker, Virginia Jaspers, confessed to shaking a 2-week-old baby that died. There is no further evidence of where these actions took place, but most would think a nurse would know that it is dangerous to shake a baby. That goes to show that anyone is capable of harming a child. There are many factors that increase the chances of having a baby being shaken violently. Those factors are: a parent has a previous history of child abuse, a parent is a victim or was a victim of child abuse, the child is one of multiple births, twin or triplet, the child is less than 6 months of age, or the child frequently cries. These factors were listed by the CDC in the article A Journalist's Guide to Shaken Baby Syndrome is Preventable. Tragic. Shaking a baby can lead to many complications. According to the Mayo Clinic, under the symptoms and causes of shaken baby syndrome, you may not see physical signs of injury to the child's outer body. Sometimes the child's face is bruised. Injuries that might not be immediately seen include bleeding in the brain and eyes, spinal cord damage, fractures of the ribs, skull, and other bones. Many children with shaken baby syndrome show signs and symptoms of prior child abuse, which is very serious. Shaking a baby can clearly lead to many complications later in life. As you know, crying is only temporary, but these damages are permanent, so it is best to avoid shaking a baby at all costs. Some symptoms of shaking a baby are seizures, comas, irritability, and bad eating habits. There are many more symptoms and effects of shaking a baby which should motivate you to not want to shake one. Shaking a baby can cause serious brain damage. Shaken baby syndrome, SBS, is an effect of shaking a baby. What is shaken baby syndrome? According to the National Center on Shaken Baby Syndrome on their website donotshake.org, shaken baby syndrome, abusive head trauma, is a term used to describe the constellation of signs and symptoms resulting from violently shaking or shaking and impacting of the head of an infant or small child. The American Academy of Pediatrics describes SBS as a subset of AHT with injuries having the potential result in death or permanent neurologic disability. In the article, National Center on Shaken Baby Syndrome, This is a form of child abuse that can be caused by a number of things, such as throwing a baby in the air or intensely shaking a baby. According to many different articles, as I stated previously, a baby might appear to be fine, but they really aren't. So irresponsible acts should definitely be avoided. Babies are not fully developed. Babies are not fully developed, and shaking them violently can cause them to bleed in the brain, damage their spinal cord, and fracturing several ribs. There are bad results that come from shaking a baby, so it is best to avoid any tempting factors when it comes to shaking one. Spinal cord damage is something that is very serious and should not be taken lightly. This could possibly damage a child for the rest of their life if not treated. Spinal cord damage can also have long-term effects on a child, like lack of mobility in the future. The American Association of Neurological Surgeons stated under the website Shaken Baby Syndrome that babies have very weak neck muscles that cannot fully support their proportionally large heads. Severe shaking causes the baby's head to move violently back and forth, resulting in serious and sometimes fatal brain injury. These forces are exaggerated if the shaking is interrupted by the baby's head hitting the surface, which can also lead to release of blood from a vessel, which is very dangerous and can cause organ failure, seizures, and other bleeding. Shaking a baby can result in death. Shaking a baby can ultimately lead to a premature death. There are many things that happen when you shake a baby. As I stated earlier, a baby is not fully developed, so it is not able to sustain something such as shaking. Their tiny brain is bouncing in their head, and they are at large risk of dying. Roughly 1/4 of shaken baby syndrome victims die each year, and the rest are left with permanent damage to the brain, so it is a lose-lose situation for both parties. Many infants die a year from being shaken. However, if they are under the age of 2 and do not play roughly with your child, that is in any way that looks like it is harmful to their health. There are many miscreants of this crime, and it involves father, mother, or even a babysitter. How can this be prevented? There are many ways that this can be prevented. SBS. It may seem hard to not play with your baby in ways that would make their health be affected. According to some studies, it is actually good to let a baby cry by itself. If the baby will not stop crying, call a doctor for assistance. There are many different factors that tie into why a baby is crying. According to American Association of Neurological Sciences under the title Shaken Baby Syndrome, shaken baby syndrome is completely preventable. Taking care of a baby can present challenges, especially for the first-time parents. This is an expert of the show Shaken Baby Syndrome is preventable. Although taking care of a child is very difficult, SBS can be avoided. All in all, shaken baby syndrome is very dangerous and can be avoided. Parents should shy away from rough playing and also tossing their baby in the air. It can lead to many complications later in life and premature death. Now let's review our topic. Firstly, shaking a baby is considered to be child abuse. Secondly, shaking a baby can cause serious brain damage. Lastly, shaking a baby can result in death. Shaken baby syndrome is something that is very serious, and many parents should treat it in that way. Many infants die as a result of this, and 80% are left with lifelong injuries. Always understand that crying is only temporary and brain damage is permanent. If a baby is crying, think about why it is crying. Do not result in shaking.